Is it safe? Should they do it? Is it lucrative?
There may be an ugly downside to the new generation of wildly popular weight loss medications.
Am I too late to the game? Everyone's doing it. The market's saturated.
The FDA updated the warning label on Ozempic to warn users of a possible link to serious intestinal blockages.
Every market of America, like, people wanted medical weight loss, and that became like this massive shift.
If it is severe, you will end up with nausea, vomiting, abdominal pain.
Because this medication can do harm just like anything else. Welcome everyone back to the channel. My name is Sam Patel. If you're new here, make sure you hit that subscribe button. We're having an amazing topic that we're going to be talking about, and I cannot wait to get started. I have some beautiful guests with me as well, but if you are new, make sure you hit that subscribe so you can follow along with our journey as we talk about the latest topics in medicine, healthcare, aesthetics, business ownership, and so much more. Let's get into it. Let me introduce my two friends and colleagues and all around badass people. I have Alicia, one of my best friends, and Mitch, one of my good buddies too. How you guys been? We had a great weekend traveling to a conference. It's Monday morning. But listen, we do not stop working, do we? We're grinding it out. We flew back in last night, had an amazing time, met so many amazing practice owners, entrepreneurs, amazing crowd. Wasn't it down in Dallas? What were your thoughts?
It's my favorite territory. It's always an amazing time when we're down in Dallas.
Yeah, it was great. Great people down there. Mitch?
It was a blast.
I know you have it's a little bit of a bias coming from you. That's your kind of old stomping grounds for a little bit.
Yeah.
How was it being back?
It was great. Yeah, honestly, it was kind of funny when we were driving to the conference. I was thinking, I was like, oh, I think I need to run home real quick. I was like, wait, I don't live here anymore.
And it felt like you were back in your habitat.
Yeah.
Like you never left, right?
No,
Listen,
not at all.
Yeah, the Texas is a growing market for aesthetics, but also a growing market for medical weight loss.
Yeah.
No pun intended. But that's the topic we're going to be talking about, guys. Medical weight loss and how it is continuing to boom. All of our clients are asking about it. I mean, every day, right?
Day.
Medical weight loss. Yeah. Sam, Mitch, Alicia, what are your thoughts about this industry? Should I get into it? Is it too late? Is it safe? Should I be doing it without insurance? All these questions, but you know what? I'm tired of hearing them.
Yeah.
We're going to talk about it today. We're going to open up that concept because there's nothing out there that talks about it. So we're going to start. And if you guys have opinions on it, this is the time to let them be known. Let's just get started. Medical weight loss. Alicia, we've been doing medical weight loss for years. I think when we got into the clinical space and we were developing our clinics together, we were doing medical weight loss before it even got famous.
Yes.
And now
were.
people are doing peptides, semaglutide, tirzepatide, all of the tides. But the biggest tide that is happening is the big tide of this industry of demand, of weight loss, rising tide.
The tide has turned.
The tide has turned. Winter has come.
Yeah.
And we are here. What are we going to do about this topic? Let's make sense of it today. All right. Let's make a promise that by the end of this segment, that everyone that's watching out there has a good amount of knowledge of, is it safe? Should they do it? Is it lucrative? Is it something that's manageable for people? We're going to dive into it. But Alicia, medical weight loss, what are your thoughts on it overall? Should we do it? Should we not? Is it popular? Is it not? Does it live up to the stigma? What do you think?
Absolutely. I think every clinic needs to incorporate weight loss and wellness services into their programs, into their clinics. I think it only makes sense. I think the biggest objection that we get right now, or the most feedback that we receive back from providers is, am I too late to the game? Everyone's doing it. The market's saturated. The obesity rate has not declined substantially at all. That I definitely do not think that they're too late to the game, that these services need to be incorporated. We always say be a one-stop shop, offer all the services so your practice or your patients can stay in the door. Your patients can be able to bounce back amongst all your services. And a lot of the missing components with clinics that we work with are wellness and weight loss services.
Yeah, wellness and weight loss services, and also vitamin therapy.
Yes.
They all kind of go hand in hand, right? They're all on the rise. And like you said, people have the clientele coming in for other things, and they're looking for this service, but the clinic maybe doesn't provide it. But Mitch, we know that there's a different kind of side to this conversation. It's not just cash-based practices like Alicia is talking about, but it's also those practices that are traditional, the insurance-based practices, the OB-GYNs, the family medicine, internal medicine, the medicine-based practices, the people that are still churning out, reimbursements, and that's their success or lack of it. What do you see, or what is your opinion on those clinics bringing on medical weight loss as a cash-based activity? Should it be done? Is it proper? Is it something that's existing? Should you not do it? What are you saying?
In this space, like my first day on the job years ago, I was just calling medical spa, and the aesthetic market is huge, right? I think it's like a $16 billion market, and everything was based around aesthetics. So it was like body contouring and lasers and Botox. And then honestly, I think I was probably about like my first year in, and that's when you started seeing people talk about semaglutide, and I was like, I don't even know what that is. And then they're saying medical weight loss. And I'm like, is that like a nutrition program? Like, none of it made sense to me, right? And it was very new. And then honestly, as that tide kind of shifted, our market changed dramatically. Like, it was, I would say 80, 90% of the clinics that I would work with and call upon were cosmetic derm, med spa, plastic surgeon. And in honestly, like 3 to 6 months, it just completely flipped. I mean, I would say probably about 80% of the providers I was working with then changed to like OB-GYN, family medicine, primary care, internal med, because I think there was finally like a vehicle for them that they go, wait, we see obesity every single day. Like, we're the experts, we're the doctors, we know how to handle this. And then that's really what I noticed as a rep, just in the field working in multiple states, that every market of America, like, people wanted medical weight loss. They wanted to feel good. People wanted to be skinny. And that became like this massive shift. Like, I think it changed the world of aesthetics forever. But I think it actually created this whole new world of wellness, which is honestly probably about 10 times larger of a market than aesthetics.
Absolutely. Medical weight loss is booming. But if we think about kind of the root of medicine and how it ties into medical weight loss specifically, being overweight has a lot of downturns of your health, right? It causes issues, of course, with your energy levels. It causes issues with your hormonal levels, causes issues with your joints long-term. You can have back pains that occur, other pains that can occur. They have increase of cardiovascular disease, diabetes, skin changes, organ change. I mean, the list goes on.
Yeah.
And so all of these people of various backgrounds, whether they're a nephrologist, whether they're an internal medicine doc, endocrinologist, they're all used to treating obesity in different ways, specifically for those organs. But now people are saying, why don't we just treat the underlying cause, being overweight? Let's go back and actually treat the issue instead of treating the symptom. Not let's put a Band-Aid on it. Oh, you have joint pain. It's probably because of your weight, but let me just give you an anti-inflammatory. Let me give you a steroid injection. Let me just replace your joint entirely.
Yeah.
Why not just lose the weight, right? And so with this mindset finally shifting, and shifting not just with the aesthetics industry, but shifting with the medicine industry, we're seeing everyone saying, well, I want to do medical weight loss. I want to provide this for my patients. However, with that being kind of understood, this is a multi-billion dollar industry, and we know how lucrative it can be. We've all seen it firsthand.
Yeah.
Alicia and I have seen it because we've done the services in our own businesses. And now being on the other side with helping practice owners implement this program, some of the fears that I hear are, Sam, I want to do medical weight loss in my practice, but I don't know how to do it. I don't know where to source the medications from. I don't know how to price this out in my community. I don't know how to market this. What are some of these topics that you guys are hearing? I mean, we're hearing these things. Am I missing something? What are some other challenges we hear about people not going into this? Because it makes sense. It's like, why shouldn't you do this? But we see people are still hesitant. What are some hesitancies you guys are hearing with, should I do medical weight loss in my clinic or should I not?
I don't know. Do you want to go first?
Go ahead,
I mean, I feel like we can talk forever.
Yeah.
I think, I like to look at like the root cause of everything. And if you think about it, obesity is a big problem. Like, it's a huge problem. Like, one of my really good best friends, he got married in Spain 2 years ago. We flew to Spain and everyone's in shape. People walk around. We're coming back and we're like in US customs, coming back to the United States. And you're like, wow, like we're big in the US. Like, there's a big problem. And it was, I've never seen it so glaringly obvious. And then watching this medical weight loss boom happen, I have friends and family that are asking me questions. They're kind of like, hey, is it safe? Is it not? I heard it's not healthy for you. I heard it's not good. And I think there's a lot of confusion out there. So to answer your question, do I think doctors should be doing this? Yes. Because when I have family members and friends asking for clarity on it, that tells me there's a huge opportunity. Because if you're a doctor, who do people trust? Their doctor. I will tell my mother something and she will go, I don't know, you're not a doctor. I'm like, touche, I'm not. But then she'll hear exactly what I said from a provider and be like, oh my gosh, did you know this? I'm like, Mom, we
told you that months ago.
All the time. And so people want the credibility of a provider to guide them through weight loss. And it is a big problem. And people are having heart issues. They're having, pre-diabetes in their early 30s. People are having joint pain. I mean, I had the COVID 30. Do you know what the COVID 30 is?
Yeah.
Yeah. COVID-19 happened. You gained 30 pounds. We were sitting at home eating pasta every day. And I started getting low back pain and feeling like out of breath. And I remember I went for like a run. I'm like, oh my gosh, this is rough.
Yep.
I need to go keto. But so, yeah, to answer your question, there's a lot of confusion out there, but I do think it's probably the biggest opportunity for any medical provider to do. Yeah. Because the human body, all the contraindications, the safety of, a pharmaceutical peptide and how to deliver that to a patient. So,
yeah. Alicia, we hear a lot of this, hey, I haven't been trained in medical weight loss. I didn't get, board certified in it. I didn't go and do that specialty. I didn't go to the Obesity Society and learn from them. But we also know how easy it is for this to be taught and also how easy it is to learn this. But we see also the negative where people are not learning it and still implementing it. What are you hearing from all the clients that message us and reach out to us and say, I know I should do this, but I don't have time to go to school for this? What do we want people to know about that?
Yeah, I think it's really important to know that there's a lot of great programs out there for providers to be able to take so they get a good foundation to be able to implement it into their own clinics. I definitely have heard a lot of providers saying, I'm not bariatric certified. I don't know about the obesity medicine. It's too long of a program. I just went through so many years of school. I'm trying to run and operate my business. I don't have time to go away for school for this extra certification. I think knowing that the programs that are out there, which is one of the reasons why I like our program, it's a nice 4-week program, gets them very comfortable with weight loss, but not just giving a patient a medication and treating that main concern, but helping them with the nutritional guidance, with how to price, how to package, and make sure that the staff is trained and well-versed in the medications that are being implemented into the clinic and what options are out there for the patients.
No, it's absolutely correct. You don't need extensive amount of education. Surely it helps, right? We're not going to take that away. And certain states sometimes require, I know some of the southern states, their state boards of medicine require them to have some CME credits. So of course, for those of you listening, make sure you understand your state regulations and legality behind it. But overall, what we've generally noticed is that medical weight loss is very easy to learn. Mm-hmm. However, I think people are becoming very cookie cutter, and I want to talk about this. I think a lot of people are dosing very cookie cutter. They're following the pharmaceutical recommended dosing protocols, which of course is a good guideline, but they just sit there and follow that. We know that patients that maybe start on month 1 with a low dose, they're losing good weight. Keep them at that dose going into month 2. There's no reason to increase it. And that's where a lot of the hesitation is. Is it safe? It's safe as long as providers properly learn how to provide this service with good training, but also good listening. Listen to your patient. Are you losing appropriate weight? Oh, you are? What are you eating? How are you drinking water? Is it enough? Are you being physically active? Are you protecting your muscle? These are just simple questions that we can ask our patients. Then we can manage these programs very safely. I've heard so many of these programs where you can go online, do an online survey, and then some doctor digitally reads it, and then you get the semaglutide tirzepatide in your mail.
And there's no lab.
There's no
or anything
lab work.
behind it.
There's no
Nope.
blood work.
Yep.
And patients are attracted to this because it's $100 or $200 a month. It's cheap. But why would you buy this medication without doing any sort of evaluation on your health?
Yeah.
These medications are safe and effective only if they're prescribed properly. So for those of you that are going online and getting these medications cheap, you're investing in your health, guys. And if your investment is small, so is your lifespan, to be quite frank, because this medication can do harm just like anything else. If you drink way too much water, you can actually die from it. There's something called water overdosing. It's actually true. So if you take too much of this medication because it wasn't properly monitored, because you got it online, be careful. Go to a medical provider. And for medical providers out there, this is a great opportunity.
Yeah.
This is a perfect platform to differentiate yourself, brand yourself differently, saying we're comprehensive. We got proper training. As Alicia said, we train on this all day long. And it's so important too. But also going to proper pharmacies and setting this up. Guys, the demand is there. People are looking for medical weight loss services, but they don't know what they don't know. We have to let them know, why is it different to go to a clinic with a physician on site or a nurse practitioner, someone certified on site, versus doing it online without seeing a single person. It's simple. It's so easy for the clinic to differentiate themselves, but we see people having to compete against that, right? Physicians are like, oh, I have to charge $200 a month just to compete with the online programs. What is your thought about competing and physicians that are not wanting to get into this because they're like, oh, it's already saturated and so-and-so down the road is doing it for $100 a month, or there's online programs doing it? We know that you can differentiate yourself with the patient experience and branding.
Yeah.
Mitch, what is your message to those people that haven't done medical weight loss, want to, but have this as their challenge?
Yeah. I mean, I'm just going to call it point blank. That's a limiting belief. Like you're putting a self-imposed limitation on yourself. You are. Sorry. Like, honestly, look at the size of the US population. Okay. Let's say, what is it? Like 300 million people, 400 million people. Okay. And then how many people are obese out of that population?
Yeah.
So we're talking close to half the United States population struggles with weight of some kind. Okay. So now we're looking at 150, 200 million people across 50 states in America. That's a big problem. It's big. It's evident. You can't not see it. So to say, oh, I'm late to the game, like that doesn't even make sense.
No.
It really doesn't. And I think as far as being competitive, that's like, you're a doctor. I enjoy business. I enjoy sales. I enjoy hospitality. Competition is really just, you have to add more value to your product or service. And what makes you unique, and why should I trust you as a provider? That's really how you're answering that. Like, it's just about adding more value. And like we say all the time, when value is clear, decisions are easy.
Absolutely.
So if I don't know the value of something, I'm going to be a little hesitant. I'm going to be like, right?
And I love one of the topics that you also talk about a lot, which is we're not treating weight necessarily.
No.
The weight's tied to some emotion.
Yeah.
It's something, that weight is causing them from doing something. Perhaps it's causing them from playing with their kids. Perhaps it's causing them really bad back pain and they can't sleep and now they're not performing well at work. That weight is, of course, the main topic, but it's tied to something.
Well, that ties to everything. And I'm sorry to interject, but like, I remember during COVID, I was working from home, I was doing cold calling, and we were watching a lot of Chef's Table. Great show, by the way. And it's amazing. And I just started cooking like crazy at home, and then we'd have wine, and I'd make pasta, and honestly, I gained like 30 pounds. And then it really, like, it kind of mentally set me back personally. Like, this, what happened to me is I felt like I lost my confidence. Like, I had clothes that like I couldn't fit. I had pants I couldn't wear. And then my wife is like, well, I think you need to buy new pants. I'm like, I can't. If I buy new pants, then I'm accepting that I've gained this weight.
It's true. It's true.
So I'm wearing like these stretchy, like kind of slack, like polyester material pants. And then Anyways, it took a while, but I noticed like dude, my back was killing me. I felt heavy. I wanted to start working out again. And then every time I'd work out, I felt like I had back pain. So then I'm trying to do, like a bench press or a squat, whatever the workout I was doing. I'm like, wow, this hurts. Like, and then I'm in the gym. I'm like, I don't even know what I can work out that doesn't hurt. And so then I'm in the gym just kind of walking around like, I don't know what to do because everything I do hurts. And then it was overwhelming. And honestly, I struggled with this for probably like 2-3 years. And I'm glad I went through that experience because honestly, like I wish I just had a good reset. And looking at what medical weight loss does for patients, it gives patients a reset, because this obesity problem's out of hand. It's astronomical. And if we can buy back a year or two of your patient's life, like how much is that worth?
Right. It's priceless.
It's priceless. And then, okay, now you lose weight. You feel like your family respects you more. Oh, wow, he looks great.
Well, people
Your
have
kids
more
respect
confidence
you.
in their workplace too.
Yeah.
People have
You
more
don't want to be
confidence.
the chubby dad at baseball practice.
Right.
Like, I want to play catch with my kid. If I'm 100 pounds overweight, my kid's going to be like, wow, that sucks.
Right.
Maybe that hurts people's feelings, but that's the truth. Like, no one wants to be that. And so I do want to ask you a question, though.
Yep.
You're a provider. I'm not. I think you were asking about competition, and I think you made a really good point that kind of slipped under the radar. Muscle.
Oh, yeah.
What is, from a provider standpoint, like talk about it medically, what is the value of muscle in this world of medical weight loss?
Sure. I think that muscle is starting to get a lot more attention
Okay.
for people's overall well-being of health. And I think a lot of industries, not just medicine, but also surgery, also chiropractic, even dentists, right? Every walk of life in healthcare is now focusing on muscle because it is the fountain of youth. The true fountain of youth is muscle because muscles regulate our long-term longevity. They regulate hormones. They regulate your adrenaline. I mean, they regulate so much. If you think about people's demise or what allows them to hopefully prevent injury, it's muscles. If you look at our aging population, they get into walkers, they fall, they hit hip breaks, and then their outcome of life is really, really low. I mean, it's becoming significantly sought after that muscle is our foundation. And so when you talk about medical weight loss, people are like, why are we losing muscle during medical weight loss? We're seeing so much of it. People are losing weight with their fat. Of course, their fat percentage is decreasing, but also their muscle tone and muscle density is also decreasing. So now we have people looking just sick. They look underweight inappropriately. And that is because of muscle being lost. If we think about medical weight loss, specifically these medications like semaglutide, tirzepatide, what do? You take this injection. The injection doesn't physically destroy the fat. I think that's the misconception. It's not like you take this shot and it burns away the fat. It's not how this works. The medicine that you take, it's a weekly injection. And that weekly injection of semaglutide or tirzepatide actually allows for patients to feel less hungry. It actually paralyzes your stomach. So your stomach basically is told by the medication, digest slower. So it actually shocks your stomach and kind of paralyzes it. Usually when you eat food, your stomach's going to work, it's digesting, it goes down to your intestines, you take the nutrition, and you move on. And that's kind of what also metabolism is fueled by. Metabolism is also fueled by muscle mass. The less muscle you have, the slower metabolism you have. The higher density of muscle you have, the higher metabolism is. So muscle, once again, is tied in here. But going back to the medication itself, it paralyzes your stomach and makes something called gastric emptying time slower. So the amount of time it takes for your stomach to empty, it slows that time down. So if I ate a salad right now with some protein, maybe I would feel full for 2 hours, but with the medication, now I feel full for the rest of the day. I don't feel interested in eating. So now my brain is told, Sam, you're full. Whereas traditionally, I would eat and then maybe feel hungry again in a few hours from now. So as a consequence, what am I going to do? Eat less. Because my stomach's full all the time. Literally, my stomach's physically full for longer periods of time. Hence, I have no desire to eat. Now, what does this mean? I'm taking in less calories. So if I'm taking in less calories, maybe my body was used to eating 2,000 calories. Now I'm eating half of that, 1,000 calories. However, if my resting metabolic rate is 2,000, but now I'm eating less, it needs to go find those calories somewhere else. So where's it going to go? To my fat reserves. It's going to say, Sam, you're eating less. We still need energy to function in your body. I'm going to start digesting your fat. The problem is it also starts taking away from our muscle because we're eating less carbs and calories, but we're also eating less protein. And protein is what maintains our muscle. So if I'm eating less generally, yes, I'm going to eat less carbs. I'm going to lose fat. But I'm also eating less protein because my stomach is full. So I'm eating less protein, and guess what happens now? I'm losing muscle. And also I'm drinking less water, causing dehydration, which is one of the side effects, causing constipation, one of the side effects because of less water.
It's not necessarily the medical weight loss peptide that causes these problems. It's really the patient's lifestyle.
It's the patient's
education.
It's
that
not
they're
even the patient's
receiving.
lifestyle. It's the lack of knowledge. And that's why medical weight loss programs out there, majority of them, I can confidently say, suck. Terrible. They're terribly ran because people are just injecting, and they're not having these conversations with patients. Patients need to get these medications properly, proper dosage, but they need proper counseling. That's why I love our program so much. When Alicia and I were designing this program with our medical directors, we said we want a medical weight loss program that can teach physicians how to execute these treatments, but also teach them how to teach patients how to eat better, how to appropriately manage their weight, how to appropriately dose water. So drinking adequate amount of water throughout the day, coaching them on how to do that. People are like, well, how do you manage the side effects? What are the common side effects that we hear? Nausea, vomiting.
Yep, all the time.
Oh, I don't want to be on a peptide. I don't want to be on semaglutide because I hear that my friend got nausea and vomiting. They're sick all night. Do you guys know why nausea and vomiting is a side effect of these medications? Because people are taking the injection, then they eat at 7 o'clock, and then they go to sleep an hour later. Well, if you go to sleep on a full stomach, what did I say earlier? Your stomach is not digesting as fast. So your stomach is full longer. And then you go to sleep and you're laying down, your stomach is now, you feel bloated. I mean, you know when you eat and you feel like the food's right here because you're like, oh my God, I ate so much.
That was me yesterday.
That's me every day. But as we eat and you're like, oh my God, I ate so much. Why did I do that? Imagine feeling like that the entire day. And then imagine feeling like that and going to sleep.
Oof.
It's going to make you want to vomit. It's going to make you feel like you're going to want to just go puke in the middle of the night. That's why the side effects occur. So how do we manage that? Tell your patient, take the injection, eat, wait at least 4 to 5 hours before going to sleep. That gives the stomach a little bit of time to empty itself because it just slowed the whole process down. That simple advice completely helps with that side effect. Another side effect,
can combat a lot of patient side effects.
Yes, by just counseling patients. So the best medical weight loss programs have not just understanding how to provide the medication, but how to understand the patient's lifestyle, how to manage around it. And people always ask Alicia and I, well, I don't have a dietitian or nutritionist on staff.
There's no health coach here.
You don't need to have one. If you have that,
Would you
that's
say
great.
that's another limiting belief?
Yes. I think if you have one in your practice, great. But you don't have to go and hire this person. These are simple things. Listen, people can go on YouTube. You can probably go click in the search bar right now and say, best diet for me to do. And I think that that's the worst thing to Google because what you should eat, I should eat, it should be all very different. It should be customized. So if someone comes to me and they're drinking 4 sodas a day, a nutritionist is going to say, drink water. That's terrible advice. And I know everyone watching is like, wait, what? The better advice is you're drinking 4 sodas a day. Is it too much to ask for you to maybe start drinking 3 sodas a day? That's realistic. And then the next month saying, we accomplished that goal. Can we go to 2 sodas a day? Then the next month, can we go to 1 soda a day? Dietitians and nutritionists, not all of you, majority of you, say, stop doing that. Come on, guys. You think someone who's conditioned to drink 4 sodas a day is going to stop cold turkey? No.
Cold turkey smoking.
It took you years to get into this.
Yes.
You're going to have to slowly get out of it.
Absolutely. So the proper medical weight loss programs are not only understand the medications, not understanding where to source these medications from proper pharmaceutical and compounding pharmacies, 503A, 503B, but also how to teach your patients how to manage their lifestyle at home. And that comes with proper water hydration and proper nutritional counseling. That's reasonable. Like, not, hey, get on a Mediterranean diet. They're not going to listen to you. What they will properly listen to is, when you eat pizza, how much do you eat? Half of it? 4 slices? Can we reduce it to 3? That's probably more obtainable. And so then the next month, can we now do 2 slices? Slowing down the process gradually. That's why the program we have built teaches physicians how to realistically have a very efficacious outcome with their patients, but also something that works. So patients actually do it.
And sorry to interrupt, but just listening to this coming in, it sounds like patients, like my family or friends, that ask me, they're confused.
Yeah.
And then there's almost, because of this massive market demand, there's a lot of companies coming in, almost like, I don't know if this is a good analogy, like fast fashion. Like, they're like, yeah, we'll sell you medical weight loss.
Retail medicine.
Retail med. I love when you say that.
There's a massive gap on actually getting something trusted and efficacious for a patient individually.
Yep.
And that's where it's like providers need to step up. Like, the world is asking doctors to join this game, because if a patient goes here, they're going to feel nauseous. They're going to have the muscle atrophy. They're going to get loose skin. They're going to look gaunt. They're not going to be very healthy, right? But if you do it the right way, through a trusted provider in a clinic, with blood work, with the consultation, with the lifestyle, now that patient's going to maintain muscle, right?
Correct.
Lose weight healthily, like reset, buy back their life, right?
Correct.
Buy back that 1 to 2 years of that weight loss journey. And then that provider, who's they've already known for like their whole life, right? Like, I know my family
They have their
doctor.
trust.
Yeah.
You
Yeah,
have the trust of your
I love my
provider.
family doctor. He's great. Dr. Bob. He's awesome. But
Shout out to Dr. Bob.
Dr. Bob, you're awesome. But there's the gap. And that's why it's not too late
Yeah.
to join in.
Absolutely. There's people that, know medical weight loss very well because they were trained on it. And then there's the people that are the wannabes, which are over here.
Okay.
You need to be right in the center, right? You don't have to be going to school for this for 2 years and get board certified and go to the obesity, association. If you can and you have the time, definitely do it. And you obviously can't be all the way over here where it's like, I'm just going to do this and half-ass do it. You have to be right in the center. You have to be wanting to do it, wanting to learn proper amount of information that you can effectively launch this. And that information includes, once again, what are the standard protocols? How should you appropriately dose patients using the standard protocol, but customizing it? How to nutritionally counsel them, how to eliminate or decrease side effects, how to manage the side effects, and how to wean patients off too.
Yeah.
Right? Patients shouldn't just stop taking the medication, because if once you stop telling your stomach that you're hungry, guess what's going to happen? It's going to become hungry again.
Yeah.
So that has to be managed too. So all of this is why the program we've built has been curated so appropriately and comprehensively, so it can teach practice owners and providers in 4 weeks how to implement this program safely into the practice. Because if you do it safely, that's how patients will have trust with you. That's how referrals will happen. Word of mouth will happen. You have your marketing.
Well, but also too, the medical weight loss is, the GLP-1 is a peptide. A lot of this is relatively new medicine. So outside point of view looking in, I'm like, if you're talking to different providers that say, oh, I'm not a nutritionist or I'm not an expert in this field, you could almost argue like not many people are.
No one really is.
Because it's such a booming thing, but it's safe.
They already have so many large patients coming in their office, and they're not helping their patients with anything. They're giving them another medication for their cholesterol or for heart disease or any other underlying conditions instead of treating the main cause, their weight. They have to offer these options in their clinics.
Yep.
Well, that's a good point. There's have you ever heard of Tim Ferriss? He's awesome. He's an entrepreneur, business guy. I've never met him. I just like his books. And I forget, I might butcher it, but one of his books, he said, do you know how many words you would have to know the full Spanish language? 100,000.
Oh, really?
There's 100,000 words altogether.
Okay.
Do you know how many words it takes to know 95%? 2,000.
Wow.
Interesting.
So to be
95.5.
95% of an expert in something,
Yeah.
it's 2,000 words.
Yeah.
Like you will know more than 99% of
Most
the
people,
population.
right.
And the difference between being like 95 to 100 is the other 98,000 words.
Right.
And then he uses that principle, and now he's became an expert in dancing. He's written books. The guy's like a business mogul, entrepreneur, he does everything, branding, website. And everyone's like asking him like, Tim, how are you so good at everything? And he goes, I just need to know 95%.
Just need to know enough to move the needle forward. Yeah.
So you're kind of saying like a program like this is the 95%.
Correct. Absolutely.
And that's
That's exactly it. That's exactly
okay. That makes way more sense.
Yeah. That's exactly it. Because people feel frustrated of, hey, I want to implement this, but because they're so used to being an expert in their field.
Yeah.
They're used to being that 100% in their respective
But that takes
specialty.
10, 15 years.
Exactly. But this does not. And that's
GLP-1s hasn't even been around 10, 15 years. It's like 3.
right. Yeah.
So-
So in terms of, the cash-based industry.
Yeah,
absolutely.
the cash-based industry of it.
And so, no, I think it's exciting. It's important and, very excited. It's actually one of our most popular programs is we have such an influx of people asking, Sam, I heard that you guys train on medical weight loss, set it up, and how to even charge patients. Because, our clients down in Texas or Alabama or Mississippi versus our clients on, let's say, the East Coast, New York City, Atlanta, Miami. Everyone's got different market trends, and even semaglutide, tirzepatide in California, hundreds and hundreds of dollars more expensive than what it would be here in the state of Illinois. So our team, of course, has to analyze and understand how much should you be charging monthly for these services? What's appropriate for your community? Because it is a cash-based service. It helps practice owners lift themselves with their revenue. And that's what I want to kind of segue into now, which is we know how it can help patients. We know that what we need to focus on proper dosing, all the things we just talked about. Once we get that training implemented, once business owners and medical and healthcare providers implement this and they feel good after going through the program, what's the expectation? I mean, if we just simply think about it, one patient, their relative value on medical weight loss is anywhere between $2,000 to $4,000. How many insurance-based patients would you have to see to equivalent to that? Hundreds.
Yeah.
So anyone that's in insurance-based medicine now and accepting a $20 to $60 copay, and maybe at the end of the day, you have a $100 transaction after reimbursements, if you get that reimbursement, this service completely annihilates that kind of mindset, right? Is that this is a good segue into the cash-based world. People are like, I don't want to do aesthetics. That's okay. That makes sense. I want to do cash-based activities, but I don't want to go buy a multi-$100,000 device. That's okay. This medical weight loss program and vitamin therapy program helps people take that first step into the door. I want to now provide cash-based activities, but I don't want to have a massive expenditure. I don't want to have a massive device payment. That's okay. Medical weight loss and vitamin therapy is your foot in the water. It allows you to get a dose of what cash-based medicine is like. It's also going to make you enjoy medicine a lot more because these treatments are changing people's lives, but also selfishly changing the practice owner's life too, because it gives them breathing room, allows them to go on that vacation, allows them to go spend more time with their kids.
Yeah.
It gives them the autonomy on their life back, the power on their life back. And that's pretty cool. We can help patients do the same, but also you can help yourself as a clinic owner buy back your time.
It is kind of funny. Like when you work as like a medical sales rep, right? Like you meet every doctor out there. And in the industry of wellness and aesthetics, you literally meet with every single provider out there. And they like every time they all think they're like unique. They're like, oh, no one understands my pain. And I'm like, actually, I met with the OB-GYN across the street from you. She said the same exact thing. And then every single one of them's like, I don't think my patients pay for this. And I'm like, yeah, I think you're underneath a rock. Like, and it's tough because you don't want to kind of be rude and say it, but I'm sitting there, I'm like, do people pay for this stuff everywhere? And, you know, I've never owned a medical clinic. I haven't waited 6 months to get paid. By the way, that sounds horrible.
Terrible.
No, the whole reason I went in the business of sales and hospitality was I wanted to get paid for what I'm worth right now.
Right.
It's like when you work in fine dining and wait tables, if I do a really good job, I get paid right now.
Correct.
So
imagine waiting 6 months for your tip.
you guys are crazy. Honestly, that makes no sense.
It's ridiculous.
Well, so many patients have such high deductibles as well.
And that-
so if they're
yeah.
denied for the weight loss medication or the drugs that the provider's prescribing to them and they're denied, where are they going for the treatments
Oh my
then?
gosh, deductibles are.
Yes.
My wife and I, like, we have 2 kids now. Very blessed. They're really cute, and I pay for my own insurance, which I'm like growing up, right, paying insurance, and I'm like, what's a deductible, right? I remember it was like 5 years ago. I'm like, what's a deductible? And then I go, wait, that's baloney.
Yeah.
That's a bologna sandwich. Are you kidding me?
Makes no
So you're
sense.
telling me as a patient, I have to pay copays when I show up, and then my deductible is $1,500 per family member. So $6,000 is what I have to pay towards before we even get coverage. So then it's like providers are like, oh, my patients won't pay for this. I'm like, you got a credit card reader at the front. You're asking me for cash every time I show
think,
up.
you know, this topic is always talked about, not just medical weight loss, but are my patients going to pay for this cash service of medical weight loss? I'm going to silence this right now. This is the easiest way for providers to have this conversation with the patient. Ask your patient how much money on food are they currently spending each month. For someone who's morbidly obese or someone who's extremely overweight, if they put together their actual day-to-day expenditures on food, it's hundreds of dollars a week. Fast food is not cheap. Taco Bell is not cheap. Mexican pizza is $4. I know because I love those things. They're terrible for your health. Don't eat them, but really eat them because they're really good.
Yeah.
But nonetheless, these things are expensive. So someone who's not properly eating is probably spending hundreds of dollars a week on food. So if I have a conversation with the patient, I ask them, how much money would you say you spend daily on food? Okay, well, I eat out twice a day. My average bill is about $15 to $20. Okay, so about $40 to $50 a day times 7 days. That's hundreds of dollars.
That's alarming.
Now we're going into thousands of dollars each month.
That's like 280.
It's ridiculous, isn't it? So after having this conversation, I open up the patient's mind and they're like, oh, wow, yeah, I am spending a lot of money on food. Well, how about we replace that with medical weight loss? Because now you're doing medical weight loss, you're spending less on food. You're actually probably saving money by doing medical weight loss. By
Okay.
patients doing medical weight loss every month, they're actually going to save money because they're eating less. Think about that.
Well, okay.
They're
Especially with the
less
gastric
food.
emptying,
Well,
they're
not
going to want
even-
to eat less.
Not even just eating less, but if you, let's say, lose 100 pounds and you were pre-diabetic,
Less medication.
less medication. Okay,
Correct.
well, copay stinks, so there's that, and then less visits.
Less visits.
Would you? Okay, so then less taking time off of work.
Less
Yes.
taking time off of work.
Which-
it keeps going.
So I mean, it's wow, that's a lot more profound. I actually have a curious question. I have a family member who recently started medical weight loss, and she always enjoyed having a glass of wine or two. And she said since starting, she no longer has the appetite for drinking.
Yeah.
Is that common? Like, do you see that a lot?
So what we see is that people that are traditionally doing things like drinking wine daily or eating something fatty daily or eating fried food often, as they start to eat less, their body starts to have more energy. Their body starts to not have suppressed amounts of molecules or hormones or adrenaline or all of these things that help us continue to be excited. So for example, when you drink caffeine, that's suppressing, or an energy drink, I should say, that's suppressing your body's ability to have those natural endorphins and things, right? So your adrenal glands would sit right above your kidneys.
Okay.
Those glands or those organs are responsible for releasing natural molecules and hormones for you to feel good, energetic. So if I'm drinking chronic amounts of caffeine or chronic amounts of daily energy drinks, those organs are no longer going to need to work because I'm inorganically eating stuff.
My adrenal glands hate me.
Probably. And so
Six
why I
cups of
bring this
coffee a
up
day.
is because now when patients are not eating those things, their natural ability is coming back. Your body's waking up. It's coming out of retirement. It's like, hey, this guy's not drinking as much energy drink. I guess I'm going to have to go back to work. So then your adrenal glands wake back up amongst other things. And it says, well, hey, this guy's not artificially drinking things. So I guess we need to provide his energy. So let me
Natural endorphins.
naturally wake back up.
It's really resetting everything.
Yeah. So when your natural ability to have energy, natural ability to have your own hormones, your own muscles do all the work for you, and you're not eating all of those things,
Yeah.
then your body's going to feel good. And it's not going to be attracted to eating those things or drinking those things anymore. So people sometimes need wine to de-stress. Sometimes people need wine to help them go to sleep. Sometimes people obviously drink wine for the enjoyment like us. But if you no longer need those things to go to sleep because you're eating healthy,
Yeah.
then your body's like, I don't need the wine anymore. Or if your body wakes up with energy, then your body's going to say, I don't need the energy drink anymore. And that's why people start not needing those things they were traditionally used to eating or drinking because their body is naturally producing that energy. If that makes sense.
Yeah.
So that's why people that they start to lose interest for those bad habits, let's call them. They start to be like, oh, I don't want a whole pizza. I don't barely want to eat a piece of it because it's not that they don't like the taste. It's that they just feel so good that they don't, it's almost like the sight of it. It's like that is correlated with me when I was overweight. I don't want that. So there's like this natural resistance to it.
So it sounds like there's almost more mental benefits.
Yes.
And outside of the physical of, hey, you lost weight. But it sounds like there's a lot of mental benefits where your brain just subconsciously is changing its behavior.
Well, if you think also, like if you look at seasonality for the states like ours here in the Midwest, there's a significant amount of increased consumption of caffeine during the winter months. Okay. Now that's also because it's cold.
Yeah.
Makes sense, right? But if we look at why aren't people drinking cold coffee in the summertime? Consumption of caffeine is traditionally lower in warmer months. Why? Because people are going outside. They're getting sun exposure. Sun exposure allows for active forms of vitamin D. Vitamin D allows for people to feel really good, feel really energetic. If you get a vitamin D injection today, you're going to feel like an Iron Man for the rest of the entire week. You're going to be like, oh my God, this feels so good. Imagine feeling that every single day. That's typically during the summer months and during the time of sun and we're outside. We don't need caffeine as much. I drink significant amount of less caffeine during sunshine months. Why? Because I don't need it because my body's naturally producing vitamin D. I'm excited. But in the winter months, I'm not outside. I'm inside. I'm always covered up. My vitamin D levels plummet. So now I'm relying on caffeine. I'm relying on energy drinks to supplement. This is why just connecting all the dots and allowing people to manage their weight, manage their vitamins, do vitamin D injections, do semaglutide or medical weight loss injections, it all ties back to the root cause, which is weight, and now giving people the ability to decrease their expenditures.
Yeah.
So all these patients that complain, I can't afford medical weight loss. Well, you can afford to pay over $1,000 in your grocery bills, or not even groceries, because
eating out.
Why don't we just cut that in half?
That's important education. I think sometimes, I don't know, I just feel like you forget those things as a person. Like, I don't know, I forget those things. And then you started saying that, I'm like, I guess you're right. I do kind of
I mean, it's just starting there. Oh, I don't know if I can afford this, doc. No worries. Let me take this white piece of paper out. Walk me through the last week of where you ate and how much it cost you. Okay, you ate here, $30. Okay, you ate here, $20. You ate at home that one day. That's fine. That was probably a few bucks. You ate here. Okay, that was a fancy dinner. That was $60. That's just the last 3 days. And you add all that up, that's hundreds of dollars each week, if not thousands of dollars in a short amount of time. Why don't I just get you on a medical weight loss program for $400 a month and you'll basically eliminate that? Their mind is blown.
Yeah, it's kind of a no-brainer.
Their mind is blown. That's where it makes it easy to sell this service, is identifying this.
That doesn't even sound like selling.
It's not.
It feels like people should just be doing that.
Yes. It makes sense.
Okay, so
Treating your patients still.
So why are more doctors not doing this?
Because they're not well educated on it. And this is not taught in med school. This is not taught in residency. What's taught in medical training is throwing pills at people.
Yeah,
Hey, you have heart disease? Take this pill. Hey, you have joint pains? Here's an injection. Or let me just replace the damn thing. It's never talked about, let me have the patient lose weight. Now we have a tool, and it's a powerful one. This is an exciting time in the industry of health. It's an exciting time to just be a human, to be quite frank with you. Mm-hmm. This is a revolution. This is a movement that has occurred.
Yeah.
And I love being one of the, we're one of the leaders in this movement. And it fuels me every day to give a practice the opportunity to go bring this to their patients. And this is a movement. Now, the question to providers is, do you want to be outside of this movement, or do you want to be a part of, or not be a part of it? Do you want to sit there and be miserable getting insurance reimbursements and having patients that need actual help and you're negligent because you don't want to bring this service in because you're scared? Were you scared in med school? Okay, yeah. How did you overcome it? You went through it. You trained on it. It's just about going over the fears, but this is so easy to implement. And that's why I love having this program. I'm so proud that we've designed this medical weight loss program to help practice owners integrate this service into their clinics. And it's so great to see, but you got to start somewhere.
Yeah. And more of like a personal story, but I don't know. I'll sidebar it for a second. It sounds like this is just way more effective. There's so many less hoops. Like, I mean, people used to sail across the Atlantic Ocean and it would take like 2 months, right? And you had to have sailors and, deckhands and to get all the way across, and food and plan and pack. Now you can just fly a plane.
Right.
Like, people used to watch VHS, DVD. Now we just stream. It almost sounds like the way you've practiced medicine in the past isn't where it's at today, and that this is the new normal. Like, this is the new where things are going.
Yeah, you're absolutely right. I mean, when we designed our first clinics, which were all insurance-based clinics, we didn't have these tools. The tools were just, okay, let me get the insurance form. What ICD-10 code can I tack onto this person? And if I can't, I'm not going to talk to the patient about it because they're not going to be receptive. But guess what? Now we don't have to worry about that damn ICD-10 code. Now we can break those handcuffs off and say, I'm going to practice medicine the way it should be, freely. And if it has some cash tied to it, okay, but you have to make the value be known to the patient. And that's just simply having the conversations like we had right now. Hey, listen, I'm going to manage your weight. We're going to talk about how to decrease the bad habits you have. We're going to give you this medication safely and effectively. I'm going to test your blood. This medication comes from a reputable compounding pharmacy, and it's properly priced in your market.
You're going to see me every month. We're going to monitor you closely. Yep.
This is a perfect program, and this makes it very easy. So, no, I think that this is a movement. It's going to, it's not too late.
Yeah.
It's still on the rise. And for people out there that are looking to bring this into their practice, listen, the perfect time was that saying, remember, the perfect time was yesterday, the best time, the next best time is right now. That whole concept that you mentioned, it makes sense. And so it's exciting.
And I think too, from like, I think about my father, and he had a lot of health issues before he passed. He passed at 71. My dad had me at 43. So my dad was a little bit older when he had me. And I'm thinking back to like 15, 20 years ago, where he was gaining weight. He became diabetic, was really sick. And I'm just like kind of annoyed. I'm like, man, I wish this was like a thing then, because he had like heart attack, he had a stroke. We were in and out of the hospital. Sometimes like if I got a phone call from my sister, I'm like, great, like what's going on with dad? And, he struggled with weight. And he struggled with a lot of these common things that most people in America do struggle with. And I mean, I used to go to his house, and he'd have like a pill case, and there would be like 18 different pills that he would take every day. Wow. And it was like, this pill is for the diabetes, but this pill is for the side effect from the diabetes. Right. And then this pill is for the pain. And then this pill is for this. And then I would like be like, Dad, like, why don't you just like work out? Like, why don't you just eat better? And it almost felt like he was just stuck. Like, it just felt like he couldn't get out of his own way. And I'm thinking about everything you just explained to me. And I'm like, if my father had something like that 15, 20 years ago, I actually wholeheartedly think he'd still be alive.
Yep.
And like,
It's crazy.
I'm just, and then all those different things that he, I watched my dad. Confidence was like, the guy was a stallion, right? Back in the day, he was a stud. And I just watched confidence drop with all this stuff. So I think providers, like, listening to you talk about this, like, it's almost like if you don't really want to give your patients the best medicine, then don't do this stuff. But if you really want to help your patients turn their life around and also, enjoy some income, like, what are you doing?
Exactly.
And I think it's almost insulting to patients if they don't even look at this. Coming from the son of someone who I've watched kind of die through the traditional healthcare system.
When your dad trusted that provider to have 15 different options or 15 different medications that you had to take daily, what is the difference with one more or decreasing the others that he was?
Why would I question my provider? And I was looking at it outside point of view. And like, again, I'm not a medical expert, but I'm like, I don't know, that doesn't really add up.
No, it doesn't.
Yeah.
It doesn't.
So
no, it's exciting. Well, any last thoughts before we close out? I think that this is a great kind of discussion of medical weight loss, how it should be implemented into the practice, the key things that need to be considered with dosing it properly, going into a program, not needing the extensive education everyone thinks that you need. Certainly education is great, but being able to implement this quickly, effectively, and safely, and being able to have a structured program so patients have the understanding of, wow, I can actually save money by going into the medical weight loss program with my daily expenditures. I mean, that simple concept, it's really difficult to debate that this isn't something that you should be debating to bring in or not. There is no debate. This is a no-brainer. And hopefully a lot of the medical practices out there quickly get onto this wave and this movement, because the movement, just like any other movement, it'll last until it doesn't. And your competition will do it, and you're going to lose patients.
Yeah.
The clinic down the road, if they're doing it and you're not, guess who they're going to? Not you.
Well, I used to cold call so many different businesses. Like, you kind of know, oh, okay, this city has these providers there. And I'll tell you what, over the course of years, the next year you call, that list is looking slimmer because they closed their business. And I'm not kidding. I had providers say, like, I had to close because of the challenges of insurance. And I'm like, man, so it's like, okay, if that was happening in a year, like, honestly, what is that going to look like 5 years from now? Right? You think these companies want to pay you more? You know what, Sam? You've been working really hard. I actually want to pay you in 1 month, not 6 months. And I'm going to give you 3 times more than you're used to. And you can prescribe whatever you want. Yeah, I don't think that's going to happen. So, I mean,
it's crazy. No, I'm excited about this. It's honestly been one of the most enjoyable things as a consultant now, being able to give people this knowledge and power and programming to bring this into their practice. But we see so many people still not doing it, and I can't wait to meet them because we have so many people to serve still. But yeah, no, I'm really excited about this. I appreciate having you guys talk to me about this and talk with me with this concept. And for all the viewers out there that have questions, I'm sure that there's a lot of personal opinions. Hey, put them down there. This is about not who's right, not about who's wrong, but about having conversations and discussions. And we would love to learn from you on your opinions. So comment below on what they are. I would love to engage in a productive conversation with you. And if you are new here, make sure you hit subscribe so you can continue along our journey of helping the world be better with business ownership, medical weight loss, wellness, technology, and all the great topics that we talk about on this channel. Mitch, Alicia, thank you so much for joining me. It's always a pleasure.
It's fun.
And thank you all for joining us today. We will talk to you real soon. Take care.